All right, it is 6 p.m., so thank you for joining us. This is the James Clinic webinar. We do this once a month, the third Monday of the month at 6 p.m. We bring an important topic and guests to you to talk about things that you might want to know to make your health better. So today we are excited to introduce Tapley Holland. Tapley and I have been friends and colleagues now for about a year and a half, maybe close to 2 years. He is going to tell you about his role in TruDOSE PRP development. So we're going to start out and have him talk about the basis of PRP, what it is, how it works, the theory behind that. Then we're going to spend a little bit of time talking about PRP at the James Clinic and the process that we use. If you're interested or you know somebody who's interested, the process and what that looks like to get it. And then we will open it up for discussion. So thank you for being here. This is recorded, so you're all welcome to, ask questions at the end. You can type them in if you don't want to be on screen. If you want to be on screen, it'll be video recorded and posted on YouTube. So I just want to make sure you know that up front. And anyone who wants to share their experiences, you'll be able to do that as well. So I see the chat is already hopping, so you keep going. And Tapley, why don't you take it away? You're muted though, dear.
Whoops, thank you, Molly. I love being on this with you. And hello to everybody out there. You know, listen, I think TruDOSE PRP basics, what is it? Many of you have had it. You take a volume of blood from your arm, just like doing a lab draw, and you process the blood in a centrifuge to separate the components of the blood based on their density gradient, their weight. So the red blood cells fall out to the bottom, and then you remove those, and then you take the remaining stuff that's usually the yellow part of the blood, and you process that again. And what you get out from the next centrifugation process are your platelets. And you can keep doing this over and over until you get kind of like the cell fraction that you want. Now, PRP arguably is the most widely studied therapeutic that exists within the medical literature. Literally thousands of articles on its use and application, safety, efficacy. But the problem is, and most of it has been done site specifically, meaning that if and this is where people have known to use it, where if you want your hair to grow, you go down to the med spa and you get these treatments where they take a volume of the blood and they give you your PRP and inject it into your scalp. Or you go down to the orthopedic surgeon's office and they give you a conservative treatment instead of, knee replacement, and you have PRP. There's two things. Number one is that these therapies have been hampered as far as their treatment understanding. We can all agree that we were created with this ability to heal ourselves, but why have we yet to progress past this understanding of what our bodies can actually heal? It's because the problem of dosing inaccuracy in the field of regenerative medicine as a whole has hindered the scientific progress and treatment understanding for our ability to see what can these therapies potentially treat. So I commonly give the example that basically everybody, if you walk into an orthopedic surgeon's office, or everybody on this call went to get a PRP treatment and you did not use the TruDOSE technology, everybody would essentially get the same treatment and we would all be treated the same. And so what I did is I solved that problem by measuring our blood to determine what is, and what people don't know is that behind all the intelligence, I had in a previous life thousands and thousands of pieces of blood data. And I didn't know what to do with it at the time, but creating TruDOSE was the perfect opportunity to take all of this blood data and say, what do all these things, all these parameters, I mean, think of thousands of pieces of blood data times thousands of parameters. What do they share in common if the platelet was held constant? And what that showed me was that there is a dose response relationship that impacts healing and non-healing. And how that relates to your treatment is you would walk into a clinic, let's say the James Clinic, to get TruDOSE. And let's say you're going to do it for your knee application. They would take a volume of blood to, a few drops to measure it, to determine a specific therapy for your specific condition. And the software has learned, the dose response related to all these types of conditions. And so you use the software to determine really one thing, and that's how much blood do I draw from you? And you give it back to, yourself to treat, whatever you're trying to treat. What I did not expect was shortly into starting my company, I sort of tripped on the idea, the benefits of the intravenous application. And that's kind of why we're probably all on this call, because the technology solved the problem. But what opened my world into the potential of what the body could potentially heal using your own blood at the right dose to essentially stimulate a response that's going to basically stimulate healing, but not to a dose to where it's going to stimulate excessive healing. The right dose that we can do, give it back to ourselves intravenously, and that's essentially what's healing a lot of these conditions, or at least relieving a lot of symptoms and presenting the clinical picture a lot clearer, so people can get healed.
Perfect. Do you want to talk a little bit about, so Tapley and I were just at the Ozone conference together and he had a beautiful presentation. So I'm just going to ask you questions from that.
Yeah.
So you talk a lot about getting stuck in the inflammatory cycle and your body just can't figure out how to get out of it. Can you touch on that just a little bit and how that progresses from minor symptoms to major symptoms to debilitation?
Because I didn't have any medical training background. I mean, I was in the stem cell industry for 20 years, but I didn't, go to medical school. So my perspective was a lot different in the way that when I started with the TruDOSE. And in that patients, when the IV treatment was uncovered, basically, all these patients started making their way to, at the time, my father-in-law's office. I can't tell you why they were coming, but they were coming with all these conditions. And so I quickly said, you know what? With no capacity, and these patients basically found validated measurement tools insulting. I said, just tell me, write down with your own journal exactly how you're healing. And if you take thousands of pieces of journal data, okay, and people with chronic diseases are describing how they're healing in a order, as this treatment is healing them in an order. Essentially, what I saw was that it was healing them in an order that if you ask them other questions, it paints a perfect picture over their life, how their body basically got to that point, and if you dig a little further deeper into say the cell mechanisms, what's actually going on? Well, people with these diseases I was collecting had all these types of problems that they were saying were healing, right? Some of these problems were so far back, from childhood, from their teen years, and they were that essentially at a very simple level, when we get injured, when we experience a trauma, our cells go into a danger response. And that danger response, if the cell cannot exit out of it, whether it's a broken bone or a viral event, or it doesn't matter. It doesn't matter what the age or what the event is. If the cell cannot resume normal function, then the body is left stuck in a feedback loop of inflammation. And it says, hey, listen, I'm not going to let you move forward with the healing process or the immune process until you give me what I need at a cellular level. And the cells throw these things in the bloodstream and tell us what they need. And guess who's picking those things up? It's the platelet in the bloodstream. But those individual problems start to stack up on top of one another over a lifetime. And that's what I was observing or reading with these journals. And what it showed was that patients had, you know, unresolved problem after unresolved problem after unresolved problem that led to these diseases of inflammatory nature that progressed to metabolic conditions if they went unresolved, and then eventually those metabolic problems turned into neurological things. So you can acquire this over a lifetime of singular unresolved events where your body is just stuck in a loop of saying, "Hey, listen, remember that trauma I had when I was 5 years old watching, something I shouldn't have watched? I'm still stuck. But if you give me what I need, I can help resume that, and fix that trauma." And which would lead to a cascading events of healing other parts of the body that are unrelated. Um, and so, and over time, as these unresolved problems basically start to stack on top of one another, your body starts to prioritize what it needs. very much like a company that's downsizing. So it'll always keep the executive levels of the company, the brain, the heart, and lungs, but it'll start getting rid of the sales team. It'll start getting members of the marketing, accounting, which are basically going to be your thyroid, your liver, sexual dysfunction, uh, all types of things. And then eventually, as these things stack on top of one another, the body can't get rid of any motor departments. And when that point comes, you go into fine motor loss, and that's when you see neurological diseases.
So one of the things you talked about at one point as well, this is great for reactivated infections. And I didn't realize there were so many receptors. I don't remember how it works on the platelet or the platelet interacts with those infections. And I think you use the term like it basically puts a bullseye on their back or targets those so the platelets can help take them out or kind of recharges the immune system. Can you speak to that a little bit?
I think I was alluding to the fact that our perception of what platelets do is just they clot, right? If anybody on this listening to this, they Google what do platelets do, your immediate first page of responses are going to be clotting, hemostasis, when in fact, platelets are actually, anything that happens to us, whether it's a broken bone, again, we watch our parents fight, we get a virus, our platelets are actually the first thing on the scene of that trauma. And they're basically saying, what do you need me to do? And they're actually coordinating traffic. White blood cells, I need you right now. And this is what I need you to do. I need 5 of you. I need you guys to wait because I'll call you in at a certain time. And simultaneously, the platelets are getting, the cells what they need. When they encounter, let's say, bacteria or virus or funguses, platelets have these receptors on them that basically engage as the first response team. So in some viral events, they'll actually start killing some viruses and eat it. Other viruses, let's say like the herpes virus, it'll surround it because it doesn't have the ability to eat it. And it'll keep it occupied and break up pieces of its DNA to gather evidence while the white blood cells are making their way down the bloodstream. Um, it does this for funguses, for bacteria, viruses. So I was basically making the argument that this intelligence, this heat seeking receptors, our platelets have always possessed the ability to deploy defenses and track these things out in our bloodstream. And that's what their purpose is, among other things. And this intelligence was already God given to us.
And I'm gonna play skeptic here for a minute because when I heard about this, I'm like, so let me get this right. You're gonna take my blood, you're gonna spin it, you're gonna charge me money, you're gonna spin it, and you're gonna give me back my blood. And that's gonna be magical. And that's gonna do something that it didn't do when it was in like the spinning of it is what makes it magical. So can you kind of speak to what changes that it doesn't do it when I give it to you, but when you give it back to me, it changes my body?
You know, what changes is the ratio. Okay, it's the ratio, and people say, well, what is, you know, people kind of get caught up in the kit that's being used, or maybe what centrifuge. It has nothing to do with that, right? It has everything to do with the fact that imagine at any given moment your body is maintaining a equilibrium or a homeostasis of cells in relation to one another at different ratios. So, for example, it could be 40 platelets to say, 100 red blood cells to 5 white blood cells. That's a ratio right now. If I get a viral event, or if I kick my leg on this desk right here, those ratios will change. And so at the time of the cell danger response, when no cells are communicating with one another, I'm suggesting that the platelet is managing the ratios of all the cells to one another downstream, because if no cells are talking, then who's managing health and disease? Um, and so, but we don't think about it that way in, say, conventional medicine. It's like we read blood panels, we see what's out of the reference range. Let's say the thyroid is high, and we give a medication to bring it down, right? Or low. But in actuality, what I saw from all these pieces of blood data is that there's what's called a hemodynamic ratio of all these cells to one another, maintaining equilibrium. So when you give the right amount of cells back into your blood. And let's just say I take a volume of blood out, I'm doing the TruDOSE treatment. I get blood drawn from my arm. I process whatever the amount that is in a centrifuge, and I remove red blood cells. Just say I remove red blood cells, and I give back the rest of this stuff in the bloodstream. So I've now delivered back a constituent of fluid into the bloodstream that has altered the hemodynamic ratio because I didn't give it back to it in its ratio form. And when the body senses that stress, it says, wow, I have an excess amount of stuff. And if the only way that I can get rid of it is I can't do it like a drug where I metabolize it, I have to put it to use. And so the only way I can do that is just start deploying it. And that's essentially where dose and ratio kind of meet.
Cool. Thank you. Let's talk a little bit about the nuts and bolts of this because, we started out in this, I think it's almost 2 years ago at this point, a year and a half to 2 years ago. And I remember really what the magic is, and I will stand behind this no matter what treatment we're talking about, is any corner office can offer you XYZ treatments. It is how they combine and stage and sequence those treatments for you. That's the magic. So
Yeah.
if you do this backwards, it's not going to work as well if you do it in the right logical order. Um, so when I started talking to Tapley, I'm like, well, I have this ozone treatment and I saw a question on this. So I think it's a perfect next tie-in. I'm like, what order do I do this in? And do you remember what
Oh yeah.
that conversation?
Oh
I'll
yeah.
let you address it and then I'll address how we've kind of elaborated on that.
No, I'm I think I'll just speak to the fact that we have all of these therapies like ozone and EBU and hyperbaric and IV nutrition and red light sauna and new supplements, and they're all needed and they're all good. I think what becomes the challenge is what sequence do we use these in, right? And I think that's the problem. And what I'm recognizing the fact that TruDOSE definitely moves the meter with a lot of things, and I think that's what it does. Is it moves the meter to the point to where you can now see what treatments do you need to do to stack on top of this. You'll never hear me say do this as a standalone, but I can't say it loud enough that doing the right things before the treatment and then doing the treatment and then the right things afterwards are the critical difference between reading people on Facebook saying I love it and reading it to say I don't know what happened to me after dose 2 and 3.
Yep. So I'll elaborate on that because when we talked, you said PRP is going to come in and be more your regenerative side of things. So we use it in our office, and each patient is different. This is individualized, personalized, precision medicine at its finest. So every patient is a little bit different, and every way we sequence it is a little bit different. In general, my patients with reactivated infections, we're going to come in, and I was one of these people. The first time I got TruDOSE, you were there. Um, yeah, you were there. No, Angie did it. And I herxed the next day. Like at 5, I got it at 3 o'clock, and at 5 o'clock, they're like, you just kind of went downhill around 8 p.m. We watched you at dinner. And for 24 hours, I was down and out of the loop. So reactivated infections, we treat first so that they don't have as strong of a Herx reaction. So if you're familiar with that term, a Herx reaction, when we start killing off viruses and bacteria, they release cytokines, they cause inflammation, they cause problems. So those patients, I like to chip away at a little bit first using other things, using herbals, using maybe antibiotics, maybe using ozone, MAH, and EBU, and knock that down a little bit. And then we use the PRP to come in and play cleanup when we feel like when we stop having Herx reactions from those. So that's one way to look at it. Now, our neurologic patients with neuropathy or post-COVID, that we're going to do a little bit different, right? They don't need all those ozone treatments, or it's not as critical to do all those up front. That's more the regenerative side. We're going to move earlier. So it totally depends. We have found the patients who do vitamin infusions a day or two prior, and the more we can tune up the system, right? So the more we can address the terrain or the body to optimize conditions, I feel like the PRP works better in those patients. We optimize the blood sugar, the CRP, the vitamin D, all of those things. I feel like it works better. So,
You know, you know, I just got a text today from, I'll give you two examples from, one was from, a mom that keeps in contact with me, and then another was from a doctor, and they said, "Hey, I got somebody calling about pans and pandas, right?" And I guarantee there's some pans and pandas people on this call. And basically the line of the question was, "Hey, what do we do here?" And I said, absolutely, do not tackle this one, because the mom was basically saying, oh, okay, great, we want to do TruDOSE, and here it is, and let's throw us in there. I said, absolutely, do not do this until you've put at least 3 to 4 weeks worth of what we just kind of simplified it into an acronym called reset, before the treatment. R is reduce inflammation, which can be a whole number of ways you do that. And this is what you would work with your provider with. E is eliminate toxins. S is support gut health. E is eliminate parasites. And about that eliminate parasite E mark, you're now gaining velocity into the week of TruDOSE. So that reset is not for everybody, but it's an easy acronym to say, hey, listen, if you're not doing reset for TruDOSE, then um, you're not doing it right, and there's a better way to do it. Another example was this mom in contact me, and her son was in bed for years, and his first treatment he responded, and his second treatment he was at the I don't know the one of the acupuncturist or something, and he was having some ticks. Now he had pandas and pandas, COVID, long hauler, the whole 9 yards. And essentially, what the acupuncturist kind of dialed in on is that this definitely is consistent with ticks. Obviously, that's the Lyme stuff. And so there's a perfect example. The mom said, "Hey, they said it was tick, or it's related to his Lyme." That's a perfect example where the treatment's actually telling you, like, "Hey, this is what I'm doing now. Go ahead and go back into the doctor's office and give them the context clues of what's happening, because they'll be able to kind of shift and say, oh, that's Lyme. Let's give you this, and this treatment, so you don't go through this response where you're like, oh my gosh, why is this doing this to me?"
and that gets to anything in functional integrative medicine, which is like peeling the onion, right? You're going to have layers, and you're going to peel off layers that are going to expose new symptoms, and you just keep working it and working it until you get to the end. Um, that gets to one of the most important things I learned, though, when you start treating Lyme. If you come in and you're like, I'm the Lyme doctor, let's hit it with, I know the answer, it's doxycycline, and you hit somebody with doxycycline and you do not do the things you just talked about. So you don't treat Lyme until you make sure the patient's pooping. Make sure that every day, not once a week. Once a week, whether you need it or not, is not a good plan. So you've got to be detoxifying through your gut. You've got to be hydrating. You've got to have your nutrients repleted. Those kind of things before you start to actually tackle the infection. You have to prep. So I think that's
Yeah,
pretty consistent.
you know, um, you're bringing up a point to where I can't tell you how many times I still like to get in the field, right? I never. It's just important for me because this is just such good work that I cannot not be in the field. Anyway, I was somewhere last week, and I hear this response a lot where this person had Lyme and they're sick, and you usually hear this from people with sick people. They say, "I can take it, hit me with it, give me the biggest dose you got," right? And while that's kind of like what you want to do because you're like, I want to get to healing the quickest way, that's not exactly how the body works. In that, let me give you an example. The way TruDOSE works is very much like fasting. I know that if I fast for a day, I know it's doing something, but I can't feel what it's doing, right? I know that if I fast for 20 straight days, you're going to feel it. Everything's just going to start breaking down, and that's damage. So the ideal response is somewhere between where you may not feel it and where you kind of feel it. But if you really, really feel it, that's not what you, because that can open up an additional problem for the doctor that they already had under control. Another example would be like going to the gym, when you haven't done, you've never worked out since you were maybe in your teenage years. You decide to go and start doing heavy squats. That's not a good idea. You're not going to walk for 3 weeks. So, so, um, and that's just not TruDOSE. That's hyperbaric, that's ozone, that's EBU, all of these therapies that stimulate a self-healing, let nature take its course response. If you're feeling it, that you could be on the razor's thin edge of maybe doing something excessive with that treatment.
Okay. We're going to have a lot of questions, I think. So I want to go ahead and pivot
Oh.
into the criteria to do it and how you do it through our office and the workup on that. So if you're brand new to this, um, there are really three pathways at James Clinic that you get to this. So first of all, if you're having symptoms, I think my kiddos have Pandas, I have chronic Lyme, I have neuropathy,
Oh.
whatever that is, you come in and we want to make sure those patients need to be worked up, right? We need to work up. We don't want to treat you with PRP if you need B12 and you have a B12 deficiency and that's why you have a neuropathy. So if you're coming in with those kind of symptoms, you need to have a full consult. We need to go over everything top to bottom, left to right, and get you worked up with the intention of doing PRP at the end. And you just let us know that that's what you want to do. You know about it and that's what you want to do, and we'll work you in that direction. And everything I do is like a pyramid. So you have to start with the fundamentals and the basics, and then you work your way to more what I consider more investment treatments, more of those kind of things. So there makes no sense to do PRP if you're going to the drive-through 5 times a week. So we've got to get the diet right. We've got to make sure you're sleeping, those kind of things. Everything we can start to take care of, we chip away at. So symptomatic gets a consult. So say you're symptomatic and you have Lyme or Pandas, but you're seeing another doctor, they just don't do PRP. So for that instance, we do a single consult where we want to see all of that work up. We want to make sure you're moving in the right direction and, put our finishing touches on it. Then we'll get you expedited to PRP. If you're like, I'm healthy and I just like doing cool stuff to like enhance my wellness and be proactive, those patients, we need to get some baseline criteria on the labs, and then you don't need to do a consult in that instance. We'll just review your labs and make sure they look okay, and then you can do the PRP. So that's how we break those down. It does not do any good to tell us you're doing it for wellness and don't have symptoms if you really have symptoms, because you're not going to get the right dose of TruDOSE and it's not going to work as well. So that's how we stratify that. Tapley, when you're talking to a new patient, it's not one and done for anything in medicine. So kind of how do you consult people? What is the commitment and the investment that you ask for to get started with this?
Well, I don't encounter or interact with patients who don't have conditions where they've just spent exorbitant amounts of money and who are at a disease state where it's basically, this is my last shot. So there's context. And if you take those types of patients and you say, what is the ideal treatment number of treatments that you need at a cellular level and at a physiological healing level, to where that the body has healed enough and there's been enough kind of like remodeling in the cell to where things are fixed that were damaged or broken, and the point to where quality of life is enhanced to where you've surpassed kind of your expectations of what you thought it could be. That treatment mark is about the fourth treatment. That's also the treatment mark, because we just had to go ask people, because it's such a you know it's not a binary response. Two people who have you know a kid with autism, they're going to have two different expectations, even if they don't speak, of what they feel is going to be life changing. So those are two different treatment frequencies, two different commitment levels, etc. But if you had to lump everybody together, it's about the fourth treatment, because at that treatment mark, all expectations have exceeded to a degree. And then their medical monthly spend has radically reversed. The, you're spending thousands and thousands of dollars, just to maintain, a quality of life that's not even a quality of life. At that fourth treatment, at least everything's changed and your financial burden per month has changed. And then there comes a decision. What do I do now? About 19% of people keep doing this as a um, kind of like as a, what do you call it, maintenance, or kind of like when I see symptoms, I'm going to do it. And those are for a number of reasons. The remaining percentage of people, they keep doing it because the prospect of them going back to where they were and the amount of money that they spent previously compared to what it's spending now, it's not even a decision.
Mhm. Okay.
So I don't have any experience with, well, I do. I just don't, the answer to that question for say, I have, I twisted my knee and I'm 42 and I just want my knee to get better. That's a completely different set of circumstances and financial commitment.
Yeah. And I assume the people we're talking about are systemic illness and wellness people, not the joints. Um, so what we do look at a CBC prior to doing this. So CBC, a comprehensive, we look at a CRP or C-reactive protein. Generally, as our labs, we want to have a vitamin D level as well. So that's kind of the minimum basic labs that we require in order to proceed with this. Um, Platelet count, we need it to be around 200,000. So you got once the procedure is going, you actually do a platelet count, so we know what the platelet level is, and that's counted into the treatment parameters, correct?
Yes.
Yeah. So if you're kind of in that 150 to 180 range, we do start patients on papaya leaf extract to stimulate platelet release. So there's an inherent recheck built into the process as you get the treatment. So here's some questions that we can go to. I think now's a good time to do that. Let's go to the cost of the treatment, the investment, because I think that's an important thing. So we obviously have our concierge medical costs, and then we are charging $1,500 per treatment. That should be able to be covered by an HSA or FSA card. So if you have any of those, we can help provide the documentation that you would need to get those covered. This is not going to be anything you can submit to insurance for reimbursement. This is a different kind of treatment. Go ahead, Tapley.
No, I'm looking at some of the questions and, I do have like one slide that I'll show if you don't mind, that kind of like maybe sequences some of these things because I'm seeing some of these questions and this will help kind of put perspective without giving medical advice.
Okay, perfect. Okay, so I'm gonna skip that one. I'm trying to order these in a way that it makes sense. So what would be the sequence for an autism spectrum disorder patient with no active infections, nutrient therapy, and then PRP? So anyone with autism spectrum disorder, we have see one of our pediatricians or our PAs or NPs that have extensive pediatric experience. All of them participate and are trained through MedMaps, which is the Medical Association of Pediatric Special Needs. So that's really where the doctors who've specialized in this area congregate, share information and data for best practices. So we want to make sure they've had gut testing. We've looked at the microbiome because of the high prevalence of that, and just a good thorough assessment. Potentially an IV infusion, and then the PRP would be, and every 8 weeks is usually what we're doing for interval on these, right?
Yeah, the only thing I'll add is that, you know, I see one person is mentioning the ATEC score, and I hope we get to this question because actually they were improved. They just um, but if you have autism, don't rule out the fact that there's possibly Pandas. And how do you know that? If it is strictly post COVID era, I think this is kind of consensus. Me talking to all the physicians and Molly, you can agree that autism is basically the brain injury result after you've cleared out the infection and all the damage or the dysfunction. Autism is basically the result of it. Most of these kids have underlying infection, and how do you know? If you give autism, or if it's autism and it's just autism, kids will progressively improve each time. If there is any type of dysfunction or underlying infectious load, you'll either see a non-improvement or small changes of things like their gut getting better or infectious load being come up, and that'll typically happen the second or third treatment. Um, but that's how you know, like my son got a treatment, he improved. The second treatment, it went backwards. I don't know why this happened. It's not because they went backwards. It's because you just now revealed the problem that you need to address, which is usually something infectious.
Okay, thank you. Does it help gut health and dysbiosis too?
It does. As a matter of fact, we're actually doing, due to some microbiome work a patient was doing with Dr. Sabine Hazen, the TruDOSE impacted the gut microbiome so much that we're actually doing a study. I think we're probably halfway through on autism patients. And I don't know the results just yet, but I'm hoping that those are going to show something that no one's ever seen. Short answer is yes.
Okay. Um, our son has had 4 TruDOSE, no change in his ATEC score, still nonverbal, aggressive, and the only improvement we had was finally normal stools after the 3rd treatment. That was for 8 weeks. Now we've had a 4th treatment and we have bad stools again. Why have things gotten worse and not improved?
This is that slide I want to go to. Can I go to it?
Oh, yeah, yeah. You can share your screen. Absolutely.
Okay. So this is something I showed at whoops. This is something I showed at the Documenting Hope conference. It was a way to kind of help parents. And this is to answer this parent's question. This will maybe give it in context. This graph represents the blue thing is a cell, and that response to red is meant to be you're in cell danger red. Cell danger red is not a clinical, diagnosis. It's kind of like an observation of they're metabolically dysfunction. They have high parasitic load. They cannot move stuff out of their body like bowels. They can't detox. They're obviously neurologic is implied. And so whatever you're doing, you got to get stuff that moves things out of the body. So my point is that if this treatment finally tipped the scales to move stuff out of the body, that's improvement. And that is the one way that you're going to start healing the physiological body. But what I don't know is what are you doing in between that time to help, augment it? And so if you're in cell danger red, which is where this person is, this is a guide. It's not an absolute, but you're doing this prep work, which she talked about, TruDOSE. And then the words I use is you kind of need to have a focused approach of 1 week you're killing things that are causing the problem, and the next week you're focused on moving it out. And so if the treatment that you're doing in TruDOSE does not fall into the category of killing or moving, don't do it. Like hyperbaric doesn't kill. Infrared infrared light doesn't kill. Infrared sauna moves it out, but infrared sauna at the danger red is too powerful. So you need to do things that are gentle on the body at the danger red, and basically and have a hyper focused discipline approach. And then as you get down to yellow, that doesn't mean that you're getting better. That just means that you're able to move stuff out of the body now. So you still follow this approach, which is kill, move, until you this may take you 3, 4, 5 treatments, depending on the person we're talking about, until you can start moving stuff out of the body consistently, like regular stools, you reduce load. And this is when you start getting into stimulating therapies. So my point is that what you're doing in between the TruDOSE is going to make a big difference and not just using this as a standalone.
Mhm. Okay, thank you. And I don't know if you're with our clinic or not. If you are, give us a call and make sure you have a follow-up appointment. I've also had some people start doing PRP and they just do PRP and we don't ever see them back. Like I need you to stay plugged in with us. That's the one thing that's so different about our clinic and the concierge model is we do something, we check to see how it worked. We do something, we check to see how it worked. And if it didn't work really well, we need to pivot our plan or troubleshoot that. We don't just go, long term without checking in and, at 6 months we're like, well, that didn't work. Well, where were we 5 months ago? Like make sure that you're plugged in with us and troubleshooting all of that. Um, okay. I
Ah,
think Okay. We did our first TruDOSE 10 days ago for my 6-year-old on a spectrum. We did papaya, zinc, vitamin C protocol, and our protocol said binder as needed. So we didn't use the GI detox because I haven't seen any flu-like symptoms or change in behavior. Now he has bumpy skin. I feel the body is struggling to detox. Should the binder be used irrespective of the symptoms? Thank you very much. Yes,
I
please.
mean, here's the good thing is that the body's trying to get it out, right? So I would say, whatever the clinical presentation is, like for example, if it's the skin bumps or if it's mania or if it's insomnia, those are things that are probably as the result of something being stirred up. And so you got to work with the provider to find out what that is and then what you should take.
Yeah, and I don't know what kind of skin bumps, but if it's that red on the back, those red, it's called keratosis pilaris. If it's that's specific vitamin deficiencies. That's going to be an omega-3 deficiency, or that can be a gluten antibody. That can be a number of things. So again, we need to troubleshoot. If that's what it looks like, it may be a different kind of skin bump, but yeah. Okay, thank you for that question. Janelle, you've been waiting patiently, so would you like to ask your question and then we have more in the chat here?
Oh, long time listener, first time.
Oh, sorry, Janelle, go ahead. You're gonna have to unmute though.
Hi, guys. No, no question. I just love TruDOSE. We are on our second dose for our autistic son, and the first dose was huge. The second dose we just had on Thursday, and it's just fantastic. That's all I'm here to say. It's been great for our son and our family.
Thank you, Janelle.
Of course.
That makes me feel good.
We always like to hear about positive outcomes, right?
Well, I do. What I hate seeing more is the fact that, that these kids are so sick. They're so you can do all the things right in the year 2025, and kids are coming out of the womb just the most just dysfunction. And the natural inclination is to I gotta fix it. Really the strategy is uh one at a time, discipline, and then patience. If you have that along with its other stuff and resist the urge to just, I got to get my kid healed quickly, the kids can get healed.
Thank you. Mike, I know you have a question, so let me know when you're ready. I have another question here. How can this work for Parkinson's? And before I'll let Tapley answer that, if you know somebody with Parkinson's, they need to be doing glutathione infusions. It is dramatic. And we had a video of a patient before and after, literally came in with tremoring so bad we could barely get the IV in, shuffled gait, the entire spectrum. We gave a glutathione infusion. And Tapley, I don't remember if you were there, that was in Sheraton. And the patient literally hopped up out of the chair and like ran out to the car in the middle of a blizzard at the end. Like it was
No, I was
stunning and it's immediate. So I would start with that and then you can address the TruDOSE side of it.
there. As far as the detoxing or just what does it do?
Parkinson's.
Well,
Parkinson's.
what does it do for the Parkinson's in general?
Yeah.
Those are the Parkinson's, dementia, Alzheimer's, MS, and then the shot injured adult, even the shot injured kid are going to be the five, conditions where even as cool as TruDOSE is, it's going to take the fourth treatment to move the meter. I would say on average. I'm not saying that's all the time. You have the story of the lady running in the snow. I was in Tyler last week. We saw the guy who limped in and basically was speed walking around the office. But what you will see, those patients are in such a emotional state of distress. In other words, my husband doesn't do the hobbies anymore. My son is unaffectionate. Um, they don't engage with the family. Those are all signs of emotional stress, which means that has got to get fixed. You can do, this is my opinion. And what I've seen is that that becomes the priority, and everything else, including the brain, is basically taking a back seat. So if you see improvements with basically emotional engagement, doing hobbies, smiling, interacting, those are the more huge signs that you could ever ask for than say detoxing or talking, because you have to switch that before everything else starts happening.
Thanks. Mike, you're up.
Hey, Tapley, can you hear me, buddy?
Yes, sir.
What's going on, man?
How
So
you doing?
Major Mike Hall, for all of you, he is the director of our elite athlete program. So go ahead, ask your question, caller.
Hey, talk to us about the athletic side of this and the high performers out there and the PRP benefits, because it's starting to become more and more prevalent. You see these more and more out in the professional sports community. I've noticed sometimes you're starting to hear a little bit of the PRP and the platelet stuff, along with it used to be just ice baths and this and that and some electroshock therapies, things like that. Whatever they got to do to get that edge. How can PRP support these athletes out there as well?
So is there overwhelming evidence that if you have a knee or a shoulder or an elbow or an ankle that's hurt, you inject PRP into that, will it heal it? There's overwhelming evidence to support that. So there's that part of it. Now let's talk about performance, eye-hand coordination, biomechanics, recall, cognition, which are things like, just name the activity, whether it's sniper shooting or whether it's playing baseball at a high level. I can tell you, and I can show you the brain stuff, that it enhances the brain if you do it intravenously to some other level. And if you do it with people who are involved in things that are high stress, high, biomechanical coordination, that they are, it's almost like it's enhanced, and the recovery is exponentially increased. So their ability to do it over and over at the same level is consistent. Obviously, eyesight gets sharper, brain acuity gets sharper. But if you do this enough times, you're, I can tell you, people with velocity, major league umpires, and their ability to call balls and strikes, I've seen it. I've seen the reports. It's crazy.
So one of the things I'm going to throw in here is we actually have a new device coming that will monitor and measure your brain function. It's called a brain gauge, and we're introducing that. We're moving our St. Louis office for those of you in the area. We're moving to the west end of the valley. We're launching this in Iowa as well as Michigan in the next 2 or 3 weeks. So basically, it looks like a computer mouse, and you sit down and you do a brain game, and it measures these things, the agility, the hand-eye coordination in different ways. And so we have objective measurements based on 2 decades of neurologic research to show you your clinical improvement. So what I would recommend is anybody who wants to do this for athletic performance, neurologic issues, we are going to be doing a brain gauge before and after, and you're going to be able to look at that objectively and see what benefit you're getting, and not just do I think it helps. So I'm just going to put in, I don't mean to interrupt you. I'm going to put in an all call for questions because we are approaching the top of the hour. So I'll give you a couple more minutes to drop your questions. We have several still to get to, but we do want to respect everyone's time. So here's a question. Does it help with stroke?
It does. I'll keep it simple. Yes.
So the one thing about this is the PRP crosses the blood-brain barrier. So we're seeing this for central neurologic issues. I think I can make the comment that we've actually seen emotional and trauma responses improve as well.
I was in an office last Thursday, who is wheelchair bound and basically has ALS to the point of end stage. And we did essentially a TruDOSE type procedure, and we gave it to him in a couple different ways, injected and then also intravenously. And he was having, movement in his and sensation and muscle vesiculations before he was leaving the office.
Great. If a child is under IV chelation, when would be the best time to start TruDOSE?
Chelation is a pretty rough treatment. I mean, it depends on what you're doing on the body. I think that you need to, I think anything that type of stress, I mean, you probably need to give the body at least a couple of weeks to respond, assuming that you're doing it under a doctor's provision and care. Again, chelation is a tough treatment, so you don't want to like do these, stacked on top right next to one another. Is it's going to be too hard on the kid's body or anyone's body.
And I'm not familiar with IV chelation in pediatrics. I would want to be at a very top specialist. Maybe you are. That's just, there's a lot that can go off kilter with that. Oral chelation for autism, is it okay to do between TruDOSE sessions? Oral chelation is a lot more gentle, a lot safer. So I would think that makes me less uneasy than IV chelation for kids. So, okay. How long does it take to see effects? I got my treatment on Thursday.
It depends on what you have. So it depends on what's the priority of what your body is, for example, okay, we know this, that 25% of people, they see something before they even leave the office, right? And those people are typically have neurological dysfunction at its core. So things like brain injury, Parkinson's, or not Parkinson's, or just motor neuron type stuff, things that are really dramatic and drastic. The next 25% of people see things before you leave the door and then the next morning. Those are typically things that are, I'll say, autoimmune or chronic type conditions, I mean, on average. The next category is about days 3 to 10. And those are typically people that have metabolic conditions like thyroid or, I don't know, things are wrong with how the body works. And then the last group is beyond that. And those are typically, it's not that they don't have things that are not wrong with them that are neurologic, metabolic, or autoimmune related. The people who see it beyond are typically people who don't see things because they have emotional distress. There's trauma there. There's childhood trauma. There's trauma dealing with the sick kid. There's trauma dealing with trying to treat your Lyme disease for 10 years. And it's very difficult to self-assess improvement when you're the ones, how do I know if I'm happy?
Yeah. And I think a lot of times, to your point, that the patient may say, I didn't notice much, but their spouse sitting next to them or their significant other that's with them all the time is like, well, you're much more chatty and you're funny, or you have more energy, or you don't sleep as much, or you're not napping all the time. Like they notice those subtle differences where the patient, is not aware of those. So good question. I have a Pandas kiddo, 11 and 9, 90% healed, but still have some tics. All pain and stomach issues are gone. Yay. Immune system is boosted. Not getting sick as often. Any ideas to boost to help get rid of the final remaining tics? And we've been doing AI paleo, whole organic, gluten-free, hyperbaric chamber, MAH, red light therapy, IR sauna, lymphatic massage, walking, weightlifting 5 times a week, and no sugar. All that's amazing. Good job.
And this is a TruDOSE patient as well? They did TruDOSE as well with all that?
Yeah.
Oh. I mean, here's a great example of what was the original question?
How to get rid of the remaining tics.
Here's a great example of, I would just, you'll never should anybody ever stop detoxing, right? And I mean, if you stop everything, you should probably continue detoxing. Eventually the problem's you've got your body in such a healthy state that now it's getting rid of stuff and it's, you're where you are. Eventually, if you keep detoxing, the symptom, whether it's a rash on the ankle, or whether it's skin stuff behind your tricep, or whether it's it will reveal itself. I promise. If you keep detoxing. So my point is don't let up on, even if you stop TruDOSE, don't let up on the other modalities that you need to keep doing, because eventually your body's in a place now where the immune system can actually respond, and it'll push it to the surface, whatever that means. So and then you and the doctor will say, okay, this is what we need to do.
Yep. Here's a very specific question, and I want to remind you guys this is a webinar, so this is for general information. This isn't for specific medical advice or specific conditions. So this one gets a little bit into that. I will summarize this one. I've had chronic Lyme over 35 years. I've had 3 TruDOSE and not maybe 1 or 2 subtle improvements, but nothing profound. So, in general, what advice would you give to this patient?
There's that fourth treatment kind of you need to get to. Typically the majority of people with Lyme that I run into have endured such emotional trauma, just the family they've lost, the things they had to give up on, all that stuff, the money spent, and you're in such an emotional state again that it's very, very difficult to see if you're improving or not. Again, it would be helpful if I had context, whether what your husband or your wife said, or what or your significant other says, because they might tell a different story. But we have a Lyme graph that shows, what does it look like over progressive treatments? And it looks something like this. There's a continual symptom improvement on the downward slope, or if you want to look at it like an upward slope of improvement. And the fact that you're saying things are improving, and you've had it for 35 years, that tells me that within this data set of 100 people, that you definitely have at least 7 or more pathogens that you're dealing with, because that's what these other people had. And these people had tried everything. And, there was incremental improvement just like this. So I would say my advice would be, you're at the second treatment. The third treatment for Lyme is typically when there's a tipping point. And then, join us on the webinar and tell us how you are at the fourth.
Yeah. So we've talked a lot about Lyme and PANS Pandas, and just if you're out there and you're like, what is PANS Pandas? It's pediatric acute neuropsychiatric syndrome. It's a constellation of infections that cause an immune response that affect the brain and cause inflammation in the brain, which lead to psychiatric and neurologic conditions. So that's what PANS and Pandas are. They're one's from strep and one's from everything else. Most doctors don't even acknowledge this. Some pediatricians will not test for it. We had a patient that went back and forth 3 times before they came to our office and got it all tucked away. But there's so many other things we're using this for, the athletic performance, the recovery. For me, the neurologic stuff. I've been a doctor a very long time, and for neuropathy, there is nothing that works. They'll throw gabapentin at you, they'll throw Lyrica at you, they'll throw these other meds at you. We actually have patients who come in and their neuropathy is gone. It is gone. And we have one patient who did it, I can't remember how many times, 2 to 4 times, for another reason, and ended up having an EMG before and after an electromyogram, where they put the needles in, they check the conduction speed of the nerves, and had one before and after as part of her workup, not with us, but just incidentally. The neuropathy was gone, totally healed. So we have proof of that. I have a family member who got this for wellness and lung conditions gone. Not having the recurrent cough, not having the asthma, not having the wheezing. We had a patient come to our office in an acute asthma flare. She got it for the asthma flares, never had asthma since. So the one good thing is this higher order, the body prioritizes the brain, the heart, and the lungs. Now, if you want your joints to get better and you're having a lung problem, it's probably going to help your lungs over your joints. So for those musculoskeletal things, everything else kind of has to be in line before we see those improvements. But those are, to me, those are the sweet spots. Speak a bit to like post-COVID and post-vax, because I think there's a rich area there that we have a lot of patients that fall into as well.
the post-COVID non-vax are going to be, they respond incredibly well because you're just dealing with whether it's acute or chronic, kind of these inflammatory fire alarms that are still kind of ringing and you can't turn them off. And this treatment seems to turn those fire alarms just off. It's usually consistent and it's usually immediate and it's usually kind of dramatic, whether it's burning, urination, neuropathy, sensation, taste, brain fog, cognition. Now, the post-COVID vax stuff, and that's going to fall into the category of, again, of the Parkinson's and the dementia. Again, that particular insult, right, is unlike any other. And there is such damage that's been done, not just neurologically, but everything to the body from a top-down perspective, that it throws the body into this state of, again, emotional fight or flight. You'll typically see it whether you're tensed up or you're walking on your toes, or sometimes people will hide it by just their brain is working too much and they're overly chatty and they're engaging, but really that's just a sign of just emotional trauma. It's their way of covering up. Or they're just the affect is so dull to where that you can't even engage with them. For those people to heal, you really have to celebrate the emotional gaining wins coming back. Because if that can tip, and if you see that return, then from what I've seen for those specific ones, there's a shot now.
Perfect. I see Brenda raise your hand. I was actually going to call you up next anyway. Brenda is our PRP nurse. She is the champion of this in our office. And for those of you who don't know, a lot happens behind the scenes. And one of the things I'm most proud of is my team prays for you a lot, and she prays over your PRP while she's processing it. So I don't know if that's part of the magic, Tapley, but she prays that you have a good outcome. I'll just tell on her. So Brenda, go ahead, dear.
I actually didn't raise my hand. I was working out, but I am happy to talk about how I use my time while the machine is counting your platelets and spinning your platelets to ask the Lord to use your blood to heal you.
Yeah. So I don't know if you like that, great. If you don't worry about it. It won't do anything, but I think there's a lot of power in that. So thank you, Brenda. Anything you want to talk about? You've seen almost every patient that we've treated. So do you want to speak to anything that you've seen that we haven't touched on yet tonight? Definitely the most challenging patients are our kiddos with like autism spectrum, just coming in and the trauma of going through the lab draw and things. But my team I'm very proud of them. They do a beautiful job with our patients. Sometimes we ask mom and dad to just kind of step aside and let us handle it so we can be the bad guys and you can be the good guys. And a lot of times what happens is if you step away, your child does amazingly well without you. So just trust that we're loving on your babies and doing a great job with that. But B, anything else you want to add?
Nope, just keep signing up and bringing it in.
Yeah.
I love watching how well this moves the markers if you're prepped for it.
Yeah. Thank you. Tapley, let's go to closing thoughts right now. We're a little bit over the hour. If you know somebody who would benefit with this, I would ask you to share this. It's going to be posted to YouTube tomorrow. We do have a great YouTube channel. We are still censored. Google has removed us from the Google My Business platform because we do things like this. So the people who need to know about us don't always. So if you could share this with one person, we would be so grateful. And that's one of the things you can do to help us help other patients. So Tapley, go ahead and close us out.
Wow. If there's anything, there's a couple of final thoughts, or at least one final thought I could say is this, is that, there's been a lot of questions tonight about kids, pans and pandas, right? And autism. And I would say that those of you who are asking these questions and those of you who are posting these chats, I can already tell that these are people that this is not their first week into this rodeo. And just judging by the words they're using and kind of maybe how they're talking. And I would say is, how do I put this? Remember how we all found out about COVID? And remember yourself when you were that beginning mom or dad with a kid and kind of where your world was and kind of like figuring this out. The only way that therapies like TruDOSE or hyperbaric or EBU or ozone are going to survive if you want them to stay around is that we have to pass this kind of knowledge on to the next person, the next mom, and the next somebody who's like this. Because obviously, everybody on this call can agree that maybe brighter days are going to happen with our medical care in the US. Maybe therapies like this and other things like hyperbaric are going to be maybe readily available. I saw a question about insurance, maybe, but the only way that that will happen is if you on the call listening passes that knowledge that you've had on a person. Because the days, I mean, we're going to have to keep educating and self-educating this whole kind of shift in how we kind of consume medicine that this is completely different. Talking about things like IV nutrition and hyperbaric is a completely different thought train pattern of how we've done it for the past 100 years. And so the only way that these things can get, I guess, we can change that kind of consumer behavior is that you have to help pass that torch on. And so um, I would say thank you for, the joining this call. And I'm so glad I love doing this. And I want these therapies to kind of change medicine, but we're going to have to do it together.
Yeah, thanks, Tapley. And I will just put in the last plug for the James Clinic. You know, a lot of times we have people ask us, like, why would I be part of concierge? I'm a healthy person. I don't really need this. Or, I'm not sick. I don't need to come into the doctor a lot. There's some reasons for that. Number one, you want to build a relationship with a team that you know and trust before you need us. You don't want to be caught in an emergency and looking for a doctor to take care of you and getting to know them and know if you can trust them. So number one, that's why. Number two, when we do labs and we take care of patients, they get a lot of information they didn't have without that. So we find a lot of things in the labs, the vitamin D level, that, early warning, in switching to that proactive care, people find so much benefit. The third thing is we are constantly going to education. So that's how I met Tapley. We were doing an advocacy talk in Kentucky, if you remember. I still remember the dinner you sat down with us. I'm like, I want what he has. It took us a while, but then we got there. But we just went to a talk where they were talking about curing people with ALS, talking about curing people who were declared brain dead and they had a treatment. So we are committed to constantly going to educational episodes like that. They talked about using hormones to treat cancer. Now, how many people have been told if you have cancer, you don't do hormones? So it's everything we've learned is flipped on our head, and we know the system doesn't work. But to Tapley's point, everything that works is under wraps. It's quiet because it challenges big pharma. So we need your help. We need you to support practices like ours. Be our patient. Just participate.
Be active in the Facebook groups.
Yes.
As far as when you see not when you see inaccurate information, just you try to change and educate.
Yes. And yes, I do order a lot of labs because how do you know if you don't test? So that's why people come to us. So I want to thank Tapley for your time. I always learn a ton. It's a pleasure working with you, and it's fun to change the world in our little corner with your help and what you've developed. So thank you for that. I want to thank everybody who joined us tonight for your time. We value that. We hope you got a lot out of it. And again, you can find our archived webinars on our webinar at James Clinic on the YouTube channel. And then tune in every month. We're going to do this and keep bringing these experts to you so that you know how to help people in your world. So thanks, everybody. Have a good night.
Thanks, Mollie.